Have you ever wondered how to calculate IV fluid without getting lost in numbers? In this video, we're going to be talking about IV flow rate, drop factor, and drop rate. So, when administering an IV medication, you want to make sure that this IV medication is administered at the correct rate to avoid having complications for your patient. For example, if you give normal saline at a very high flow rate, it could cause problems for your patients. Problems like cardiac overload, heart failure, even hypertension, and it could also be a huge problem for the kidney to excrete all these fluids because of the cardiac overload that this medication has given to the patient. That is why it is your duty as a nurse to ensure that you administer the IV fluids at the correct rate. So now we have the first method here. But before we go into that, we are going to look at some parameters like flow rate, drop factor, and drop rate. So the flow rate is the rate at which the medication is administered to the patient, and that will be our main focus for today. And then we also have the drop factor. The drop factor is determined by the IV given set, which we are going to be discussing in our next video. We also have the drop rate, which is also determined by the drop factor, the amount of the fluid to be administered, and the time for the fluid to be administered. We'll also discuss that on our next video. But for the sake of this video, we are going to talk about the flow rate. So to determine the flow rate of an infusion, you must have been given the volume of the infusion and the time for at which this infusion is going to be placed. So let's look at the first example. We have it that 1000 ml of normal saline is to be administered for 8 hours. So what will be our flow rate for this particular infusion? So remember that we want to administer this infusion for 8 hours to achieve optimum results of the infusion. So what you're going to do first is to know the formula for calculating this IV flow rate. We have the basic formula for determining the IV flow rate, and that is the amount of fluid in mils divided by the number of hours that this fluid is expected to run for. And the answer is in mils per hour. We have the first question here, and it says that 1000 ml of normal saline is to run for 8 hours. What will be the flow rate? So let's head over to our calculator and do this. We already agreed that the formula is the amount of solution in mils divided by the number of hours. So we are going to plug that into our formula and get the correct flow rate for this normal saline that has been ordered for 8 hours. So for the amount of solution, we have 1000 mils. So we are going to write it down, 1000 mils. And the hours that we are to administer this drug is for 8 hours. So we're also going to write that down. So we are going to have 1000 over 8 hours. And if you do the calculation in your calculator, you'll be getting 125 ml per hour. That is to say, if you have 1000 ml or 1 liter of normal saline that is to run for 8 hours, you are going to administer it at a rate of 125 ml per hour. This IV flow rate is regulated by an infusion pump. So when you've calculated the value, you go to your infusion pump and set it to run for at the rate of 125 ml per hour. So if you run this fluid at the rate of 125 ml per hour, after 8 hours, you'll be able to administer 1000 ml of normal saline. Let's go to the second question. For practice sake, we have to do several questions so that we'll be able to master this formula and also to master the calculation as well. So the second question says you have to administer 500 ml of Ringer's lactate for 6 hours. What will be the IV flow rate? Let's go back to our formula as we did in the first question. We agreed that the formula to calculate IV flow rate is the amount of solution in ml divided by the number of hours that the solution is to run for. So plugging in these values into our calculator, we are going to have 500 mils divided by 6 hours. So if we punch it in our calculator, we are going to be getting 83.3 mils per hour. And because of that, we are going to approximate it 83 mils per hour. That means that if we set the infusion pump to deliver this IV fluid at the rate of 83 mils per hour, we'll be able to administer 500 mils of this solution at the end of 6 hours. I believe we've understood these two examples, so we are going to go over to a more complex one that has a different shape, but trust me, you're going to understand this one better. Picture a scenario where you set an IV fluid to run at a particular rate, and after some time, it stops, maybe because it has infiltrated the nearby tissues. How are you going to know the amount of fluid that has entered into the patient or the amount of fluid that is left in the bag? That will lead us to our third question on this video. It says an infusion running at 60 ml per hour stops at 7 hours. How much fluid is left in the bag? For this question, it says that the amount of fluid that is being administered is 1 liter. And this 1 liter is equivalent to 1000 mils. So to get the volume of fluid left in the bag, we have to subtract the volume of fluid already infused from the total volume. So to get the volume of fluid that has already been infused, we have to multiply the flow rate by the time spent giving this infusion. We have it that this infusion has run for 7 hours and the flow rate is 60 ml per hour. So we are going to multiply this in our calculator. We are going to do 60 ml per hour times 7 hours. At the end of the day, we are going to get 40 mils. So this is to say that at the space of 7 hours, 420 mils of this fluid has been infused into this patient. That is the first stepping stone. Now the question says, how much fluid is left? So we are going to determine how much fluid is left in the IV bag to get to our final answer. So to do this, we are going to subtract the volume of fluid already infused from the total volume. And they said that the total volume of fluid is 1000 mils. And having administered 40 mils already before the infusion stopped, you can derive how much fluid is left in the bag. So to do this, we are going to subtract 420 mils from 1000 mils. You can do this on your calculator. You will get 580 mil. So that is to say that if an IV fluid of 1000 ml administered at the rate of 60 ml per hour stops at 7 hours, the amount of fluid already infused is going to be 420 mils, and the amount of fluid left in the IV bag will be 580 mils. I hope you learned something from this video. Do well to comment, like, subscribe to this channel, and share this video to your friends in nursing school. This is going to help them in their struggle with the calculation of IV flow rate. On our next one, we're going to be talking about drop factor and IV drop rate. So stay tuned for the second video. There you're going to learn how to calculate IV drop rate using the drop factor. Bye.